So yesterday was surgery, and today I've just been recovering. I'm at the hospital still. It is, I think it's about 7 or 8, I'm not sure, p.m. And, let's see, I'm trying to figure out how to say I'm a little out of it. So yesterday when I came to the hospital, it was about 6:30 in the morning, and got in, checked in, and then they brought me to this little room where they did vitals and did all the paperwork, and and they started an IV, and they had me use the bathroom and do a pregnancy test, and then I talked to the doctor, and I had to wait a couple hours longer because he was in surgery with someone else that ran late, but it was fine. And then I just brought my phone and I was watching like Netflix or something, and then he like had numbers of people to call for me because I didn't come with anyone. It was just me. My mom lives in Colorado and I'm in Virginia, and she has to work, so she was like the number for him to call, so she would then like know and tell everybody else. But I didn't feel the need to have somebody waiting for hours in a waiting room for me. So I was fine on my own. So when they were finally like, we're going to wheel you back, and the anesthesiologist nurse came and she was like, I'm going to inject something. It's going to help you get a little sleepy. Like, by the time they wheeled me out of that room, I was gone. Like, I don't remember anything else. The next thing I remember is waking up. I'm not even sure where, because I was so loopy, and like, you think of those videos of people who are coming out of, like, mouth surgery, and that was me. Like, I was like, people, or, like, just crazy stuff coming out of my mouth. And I remember that, but I also remember, like, not having control, and I didn't like it. And I'm like, I don't like feeling this way. So I was a little upset that I was so loopy, but I eventually came out of it. My mouth was so dry, and that's a side effect of the anesthesia, and they don't let you drink anything, so I could have ice chips, but like my lips were chapped, and eventually they gave me this lip moisturizer that I can just kind of like rub on, and that helped. And so that was the main thing for me, is just feeling so dehydrated. But I mean, they have fluids going all the time, so I'm not technically dehydrated. I'm a little out of breath because it's kind of hurting to breathe deeply, but that's because I haven't passed all the gas yet. So that's another thing, is they pump you full of gas, surgical gas, into your abdominal cavity. And so you have to move that by either burping or farting, and it gets absorbed into your tissues. And so right now it's still there. Plus my muscle wall is sore. That's what the doctor said. It feels kind of like sharp stabbing pains. And it is painful. But this thing I have around my neck is actually, it's called an on-cue pump. And let's see if I can open it. Come on now. All right, 1 second. I'm going to put this down and try to open it. Okay. So it's this ball of medicine, and it will shrink as the days go by. But it's hooked up to my stomach. So I'll show you, and you can see the incisions too. And my doctor was really awesome about it. Like, he kind of made them close together. But all right, so not for the weak of stomach, but I'm going to show you my incisions. So avert your eyes if you don't want to see it. But yeah, so that's pretty much it. I'm in hospital underwear. I think, yeah, there's one there, and then all right there. I don't think there's one over here. No. So yeah, it's not that bad, but there's the on-cue pump. And what that does is it delivers pain management medicine to my incisions, so I'm not feeling them, and I'm not feeling pain from them. I have to be careful when I cough, just because it hurts. And normally I would be sitting up. If I have to cough, sit up and hold a pillow to my chest. But yeah, so the big thing is walking. To move the gas, you have to walk around. So when I do that, we unhook my pulse ox line and the thing that's connected to here. I'm not quite sure what that does, but it's there. And this gets connected, so they have the readings up there. But I take this thing, and it has like this round, whatchamacallit, and I just kind of hold on to it like a walker and just do rounds around the nurse's station. But yeah, that, and then as of today, this morning, I can do fluids. So we have these little cups. They brought me ice water at first, which is okay. A lot of people I've heard say don't do cold water. It didn't really bother me. So, and I have been blessed. I don't have any nausea. I'm not feeling ill at all. I feel fine, besides the stomach pains. But no nausea. They gave me a few doses of Dilaudid, which is like a morphine, I think, and that would put me straight to sleep. So I started doing this routine where I would get up and go for a walk, and then when I got back, I'd use the bathroom and try to pee as much as I can, and then I would do the incentive spirometer, which is this thing, and the way this works is you breathe out all your air, so and then you just let it out, and that thing falls back down. But it helps keep your lungs clear so you don't get pneumonia. So let me try to put that back up. And they have a bunch of videos on the TV that they pick specifically for your surgery and your recovery. And the videos kind of explain what things are, how they work. They'll explain pain management, discharge, just a bunch of things. So, yeah. And then for breakfast, they brought me hot broth, a little bit of Jell-O, and tea, like unsweet iced tea. And so I'm supposed to mark on this clipboard all the ounces of fluid I have, and you can kind of see the breaks when I've taken naps. So I'm supposed to do 6 per hour. Yeah, that thing will beep at me all the time. So that's a little annoying. But anyway, so it was easy yesterday, just doing that routine. And then Dilaudid would knock me out. And so I'd sleep for a little while, and then I'd get up and do it again. And I got a sore throat for like a hot minute. And then they gave me a lozenge that really helped. But yeah. Sometimes I feel more weak than other times. It does kind of hurt to get up, but this pain will pass, and I'm more energized at night than I am during the morning and early afternoon. I could have gone home today, but it snowed, and I'm kind of a little just cautious about that because I don't want to get home and slip and fall. So the doctor said I could stay another night. So also the pain was pretty intense today. And so they were giving me some other kind of medications. So after we stopped the Dilaudid, I went to oxycodone and gabapentin and Tylenol. The Tylenol was via IV. The oxycodone and gabapentin are oral, like liquid. And then she gave me tramadol, I think, recently because I was in so much pain. But it's not like, I don't want to scare you. It's not like terrible pain. It's painful in the moment, but it passes. And I'm so glad that I got this done. I was a little bit nervous right before they put me under because I was like, what am I doing? This is like a huge thing, and you have that moment of panic, but it's fine. And like when I woke up and I'm like, oh, it's done. I don't feel any different, except I don't feel hungry. Whereas before, like when I was on the liquid diet, I would get a little hunger pain. But now, like, I've been watching TV, seeing so many commercials about like French fries at Taco Bell for some reason. But like, I'm like, oh, that looks so good. Like French fries and cheese sauce. And then I'm like, well, it looks good to my mouth, but I actually am not hungry and I'm totally fine not eating. So that's a nice feeling. But I don't know how long that lasts. I'm sure not forever. But they've given me some instructions about like when I go home and having protein shakes, drinking 64 ounces of fluid per day, and really just sipping. You can't chug, so you have to sip. Part of that is not getting the air in. So I'm going to fill this cup and just kind of show you. So let me sit up a little bit. So the other nice thing about the hospital is that they have these beds that have the automatic razor thing. So if I went home, I'd be in my flat bed. But so here's some iced tea. And so just pursing your lips and taking little sips. And this doesn't take too long. And because it's fluid, it goes straight through the pouch into the intestines. So you don't have to worry about filling your stomach up because it's not going to happen. It just goes straight through like it was a funnel. So and done. And then, depending on what time it is, it looks like it's 8:20. So for the 8 o'clock, I can take my first check mark. And there's an ounce of fluid. So yeah. All right, long video, but hope this gives you some more insight into what it's like after the surgery. Oh, another thing to mention is if you can see down at the foot of the bed, there's a leg pump thing right here. Now, I don't have them on right now, but it's just like a little thing they wrap around your calves, and it pumps, so it kind of massages your calves and helps you not to get blood clots. And they will send you home with injections that you have to do yourself. They're totally like simple. I think it's called Lavoxin or something. Anyway, it's supposed to prevent blood clots. And so you pinch your skin, you put the needle in, and then you just press it down, and then you take it out, pop the needle into its protective plastic case, and you're done. And I think that's a once a day thing. So they'll send you home. They'll teach you how to do it. I give myself insulin injections all the time, so I'm kind of used to needles. But I know some people get scared of them. So, all right, I'm going to put myself back down a little bit. One thing I would suggest bringing, and I know we're just going to make this a longer video, but one thing I would suggest bringing would be some hygiene products. They'll give you a toothbrush and toothpaste, and you can brush your teeth the first night. But, like, I started feeling kind of gross, and obviously my hair is kind of greasy right now. I need to go shower, but I just don't feel up to it. But I brought a brush and some lotion, some deodorant, and a razor because I have to shave my face, otherwise I get little pricklies. And that's part of the polycystic ovarian syndrome. And I'm hoping that goes away as my body normalizes with a healthy weight, but we shall see. Anything else I should mention? They give you a TV, you have movies. I've watched 2 movies and a Hallmark movie on the actual TV channels. Mostly I've been sleeping, though. I'm kind of bored with the TV. And so I guess you could bring a book, you could bring other things. You could watch movies on your phone. Bring a phone charger. Yeah, that's pretty much it. And then I should get discharged tomorrow midday. I have a friend who's supposed to pick me up. He might be working, so I might get someone else to pick me up. And then it'll just be rest at home. But I will still need to get up. I'll still need to drink fluids and probably my protein shakes. I'll see what the doctor has to say. All right, well, let me know if you have any questions. And yeah, thanks for being there.